Life Touch Millions Media podcast project. And I am Dr. Eve, everyone. I'm your host tonight, Dr. Eve Angel H. Savage, and I'm helping providers integrate technology into practice for the well-being of humanity as we build healthier communities. Many of you know I've been blazing the trail around the state and the country to redefine well-being as the highest form of equity. And that would mean economic stability, access to healthcare, quality healthcare, access to quality education, neighborhood and built environments, and of course, social support and social capital. And so we have a very special guest tonight. Thank you for the last minute on the spot with the bariatric social worker, one of her name is Candace Moxey, again, with all the letters, MSW, LSW, LMSW. She is the founder of Marley Wellness, LLC, and goes by the bariatric social worker on Instagram. That's how I found her. Love her work. Candace received her master's in clinical social work from Columbia University with an aim to help fill in gaps between healthcare and mental health care in the bariatric weight loss surgery community. Wow, I love that niche. She currently is a practicing psychotherapist in both New York and New Jersey, working with young adults and adults. As an expert in the field of bariatric mental health, she also facilitates psychoeducational and support groups. Candace's philosophy is to encourage and inspire human wellness, mind, body, and spirit by assessing needs, critical thinking, education, problem solving on an individual, group, and community levels. Boy, that last sentence was spot on because I had added a couple of questions, and I'm sure you're going to be able to help me dive right in at the micro, meso, and the macro levels of work. So thank you again for being here and welcome. So is there anything else you would like to add to this, Candace, about life, business, and career?
Well, that was a great intro. So thank you, Dr. Eva. I really appreciate being here. And just as a social worker, and I'm pretty sure that there are other social workers watching this, that we do lots of things. So I've got other jobs that I do too. One of them is in a nonprofit sector. I work in a workforce development organization. And so I'm doing student services, helping connect young adults to resources so that they can have amazing careers that they might not have been able to access, given their situation. So I do lots of things.
Wow. So I like that right off the bat because, ordinarily, I would be working at a college or with a PhD or in a classroom or something like that. But I am very non-traditional as well. So I get that workforce giving them the option of opportunities for themselves. And I love that too. We'll be talking a little bit more about that. Yeah. So I heard you say that you are working, you're working in the private sector as well, and then you're working independently in your own business. Do you also work in a public institution?
No, not anymore.
Okay. So it's just independent and private.
And nonprofit and private.
Mm-hmm. Got it. So tell us, so it sounds like this other next question is going to be a moot point because you've just answered that. And that question was, have you been able to extend your practice? So you started in the social work industry. Tell us a little bit about your beginning in the social work field.
Absolutely. So I think that social work chose me. My interest has always been about working in groups and, growing up being like a counselor, working in the wellness space, being in education management. I've always had this interest in being able to help lift up and inspire people to get to where they wanted to go. I just didn't know that social work was a thing. And so my bachelor's is in sociology and anthropology. I minored in psych. So the social sciences were a thing for me. But as I, went through life and work, I had my own personal experience going through bariatric weight loss surgery. And I kind of just noticed some gaps in care, just in terms of the supports that people have once they've had the surgery. Who can they turn to? What those conversations are like. And so being able to speak to some of the people that were working in the support groups at the time, it kind of directed me toward looking into certain cognitive therapies and social work as just a profession. And I had no idea what that was. So I went home, Googled things and was like, what's social work? And so what it looked like to me was advocacy. It looked like policy. It looked like change. It looked like, learning about different techniques to help people break through barriers. And that was right on target for me. So not only do I want to reach the bariatric community, but I'm also working in the non-bariatric community, right? Working with the young adults, the teens, the adults, because depression, anxiety, they exist and everyone needs support. And so I am here. I am a lifer.
I am totally in agreement with that. My life's work centers online social support as well. So I'm just absolutely delighted to be sharing with you in this moment. Let's shift the conversation a little bit. How is practicing social work digitally different from doing so face-to-face?
Oh, Dr. Eve. All right. So let me tell you, when I was in school in my master's program at Columbia, we were not having conversations about doing treatment in virtual space. It was all face-to-face, right? There's technique behind it. There is theory behind it. There is evidence behind looking at people's body language, how people talk, how they're dressed, how they smell, right? So that's what we're trained to do. But I got hired right out of grad school at a tech company. So I actually started to use some of these practices at a startup, being on the phone, just listening to people, right? So I couldn't see them, I could just hear them. So that alone was, how do you use the work that I was taught, but only on the phone? Like, that's very odd. But your senses sort of just kind of kick in, right? And so that actually translated into me being very comfortable working in a digital space. There are differences, but you have to use different skill sets to be able to catch on, right? And it's so effective. It's so effective. So in person might be really helpful for those who are, in crisis, right? If you can be there, great, but you can also reach them virtually as well. And then virtually might be helpful because you can see people when they need to be seen, in their homes, in the the comfort of their own space, at different times of the day and the night, and it kind of works for scheduling. But in reality, it's just still using those same skill sets to be able to help the person. So you're just fine tuning all the stuff.
Yes. Thank you for that. How do clients express their pain via an online social support platform? And is that effective? Do you find that effective?
Yeah, I mean, so tears are tears, right? You can see them, you can hear them. You can hear a person, you can turn the camera off and you can hear the how a person sounds. You can see how a person is showing up in the virtual space. If a person's, heads down and they can't look at you, or they're just off camera completely, or if they don't have the camera on at all, there's something going on there, right? And so I think that where we are now, because we have gone through such a transformation in terms of moving into this virtual space, whether we wanted to or not, that a lot more people are very comfortable now kind of expressing themselves with that sort of distance between us.
Yeah.
Which is helpful for some people, and some people it's not. So it's just, you kind of have to know what they're dealing with and recommend, maybe we should have a couple sessions in person. because it seems like you might need that physical space. I need to feel the vibe. And then some people, it's virtual still okay.
Yes. So you mentioned the body language and feelings to being able to see. I know that in the past, it was considered a non-humanistic approach to do social work of any kind in a virtual space. And in 2016, I studied an app, and I don't know if you've heard about it, but it was an app called HS, Addiction Comprehensive Health Enhancement Social Support System. It literally was an app that was in pilot at the time during 2015, 2016. And I chose to actually, no, 2014, I chose to actually study it. And it was amazing because I heard you say, as a tech, somebody who's from the tech space doing this kind of work, how easy it was to provide intervention. Because how do you use mobile applications? And if so, what are some of those that you use? What are some of the interventions that you can provide to someone who is in crisis in a mobile app environment versus a face-to-face? Is that?
Yeah. So because I deal with work with like teens for the most part, they're the ones that really like to be in the virtual space, except they're the ones that you like don't want them to be in the virtual space. You want them to be face to face, but you meet them where they are. Right. So I definitely so let's just say there is someone in crisis. Apps like Calm for meditation purposes, even text apps, text lines for crisis, right? It's easier for them to talk via text message than sometimes on the phone. So I give them things like that. Being able to use oh my gosh, it's like I'm losing my.
That's okay, take your time.
Oh my goodness. Side note, I've worked with younger kids as well. And so I've also used different like technology with them. So sometimes we're playing like games that they want to use, like Roblox, right? To be able to some play. So, and that's super helpful with like younger kids. But teens kind of like talk more. So they're not, they're not as horrible, like they're not as hard to get to. But being able to provide them, like I said, with like meditation apps, being able to give them like text chat lines just in case they need to reach out in the middle of the night or something like that. Yes. What other kind of apps do I use?
Are there any Geo Mapping? Because I know the one that I studied, it had Geo Mapping, like Word. This one was more for adults. And it was more for addiction relapse prevention, to keep, these were individuals who were literally in a treatment facility, and they had to step down process out of a treatment facility. So many of them had tore down their social support systems, that they didn't have a support system when they were leaving, and that made it increase the possibilities of them relapsing because they didn't have any support systems or places to go, as many places to go within a community or neighborhood. So what they did was they used this application, this mobile app on the phone. Look, I want you to check this one out. It's called HS, ACHESS. And that app literally provided education, intervention. It had a map, a GPS on it. It had a GPS that was programmed person specific, just to let them know or trigger the response between the individual who was in treatment and the case manager. So that the case manager would know, okay, they just triggered into a zone that's not going to be good for them. And so it would pop in, they would trigger it to pop in education, pop in, intervention to say, do you need support? It was an amazing app. And the only thing of downside to that was, like most things, when they come out in pilot, you study it, it's a good thing, and then it's going to market. And so my concern then was, how do the people who need it now access it, who don't have, the marginalized populations? Right. I know there are many who can afford it, but there's always that marginalized population who need more support. Let's dive into that area really quick about marginalized populations. This tour that we're on in redefining well-being as the highest form of equity is to address the inequities that exist within our community. As social workers, we tap into a lot the individual, the family, and the community as organizers. But we also look at these social determinants of health as a way of providing alternatives and or fighting or developing policy and or representing our constituent base. So when you think about yourself, let's talk about you as a bariatric social worker. Get that right?
Yeah, you got it.
Bariatric social worker. Tell me, in terms of your leadership as an independent social worker who has launched her own practice, you did so because there was a need, right? Cool. So that addresses one. Where did you see the greatest gaps in service in healthcare for your work?
Yeah, so mainly when a person is going through this process, there are some things that are required for them to do before they're actually cleared for surgery. And one of them, and it changes hospital to hospital and insurance to insurance, which is its own issue, but it's to attend support groups, right? And so some of them have to attend months and months and months of support groups. Some are just like 3 groups. Right. And so in those groups, the conversation is usually, and no disrespect to any like nutritionist or anything like that, but usually it is a nutritionist that's kind of speaking from the books. This is what it looks like. This is, what to expect. But going through it myself, I realized that one, not being able to speak to someone who has actually experienced this was a gap in itself, and coming from like a real space. But once they have the surgery, then what happens? What happens there? Where does that person go, right? So there's so many positive experiences, but then people sort of like fall off the grid a little bit, and then there's no more data. They're like, what's happening with the surgery? It's a very, very a wonderful intervention for weight loss and long-term weight loss. But there are some other things that are happening that don't get marked because people sort of fall off the grid. They already went and got what they wanted to get, and now they're gone. And that happened to me. And I was very concerned because I said, if I'm going through this, and at the time I was on YouTube documenting my journey, and I saw other people talking about it too. And I'm like, what do we do about this? Who do we talk to? And I realized that there were no therapists that even really had any expertise in this, because it's a very unique experience, just like any other kind of health concern. The support groups are not having conversations about what those psychological effects are after weight loss surgery. They're really just talking about and I know this for a fact because I run support groups for a hospital as well, where it's like, can I still drink soda? Can I, what does the recovery feel like? Can I chew gum? It's the same kind of like, fresh eye kind of questions, but the ones who might be 3 and 4 years post-op, who might have very different experiences, don't have a place to talk about.
That's true. That's so true, because I've had friends who've had the bariatric surgery. Some of them, had regained the weight.
Yes.
Many of them had physical and psychological side effects as a result. Even post bariatric, years down the line, just like you said, hair loss, all kinds of things. And so I do believe that social support groups are very, very helpful in our line of work. Thank you for sharing that. How has this helped you, Candace, to stand in your power as a Black woman economically?
Well, that's another piece to it, that I go to lots of conferences and I, try to educate myself for my own personal well-being as well as education to help support other people. But what I recognize was that there are not many people of color, people that look like me, that are providing this information at these conferences, attendees. And so that was a big, big area for me. Like, well, then I'm going to be there. I'm going to step into that space. And it took me some time to talk myself into it, but God was like, go forth. And I'm like, okay. And so now in this space, I feel like I'm literally like in my calling. It takes time to build all of this out, and there's so much work that can be done, so much, because everybody's story is so unique. But I just want people to know that you have the support. It's out there. I do look like you in a lot of cases. And even if I don't, I'm here to support you as well. And our story as Black people is different. Even with weightless, it's just very different. The resources that we have access to are very different from the next person. And so that's frustrating, but I want to be able to connect, people who look like me to people who look like them, to help them support this transformation. So
absolutely. Thank you so much. Now we're going to dive, because there's these 5 determinants. You touched on economic stability. It's helped you to stand in your power as a Black woman. You shared with us where the gaps are in healthcare. What about access to education when it comes to obesity in general? Is that something that is being talked about in the bariatric community? Is that something that...
If it is, it's not being talked about loud enough or enough, right? And so again, obesity is it's stigmatized anyway, right? So the conversations, nobody wants to have them. Nobody wants to have them. And so those that are having them, no one's really seeking that information either, because it's almost like an assumed, like, it's just what it is. This is just who we are. This is just how it's going to be. And so, yes, there are people in this space that are providing that education, but it's such a unique experience that it's still not like widely accepted. It's like it's talked about very surface level, and not many people are seeking that information, is really all I can say.
Yeah, so that's concerning to me, because I know that there is the stereotypes and there is the conversations that center, what is it? Stop body shaming, stop body shaming, but there are some very real issues that cause chronic illness in our children. I don't think it's a conversation we need to dismiss. Because it doesn't just, yes, there are medical reasons. Yes, there are psychological reasons why this stuff happens. There are biological reasons why this happens. But chronic illness is killing us, and obesity is a chronic illness. And so I don't think it's a conversation that should be dismissed. I do think we need to handle people with care and not look at it as somehow they're bad people or they look bad because of. I'm thinking about this from an internal, physical, psychological perspective of how do we have these conversations without the rest of America believing that somehow to have this conversation is to body shame.
Yeah.
How do we do that?
Yeah. I mean, I think that there are people that are advocating for more training, especially bedside manner in hospitals, in schools. There's a lot of literature that will come out. And again, if you're not in that space, then you don't even really know that it exists, but it does. So if you're watching this and you want some information, there's some. But so it really is about that vulnerability of being able to kind of share where you're coming from, your thoughts, your experiences, and really just knowing that like this is something that people deal with across the board, right? And so it's like it's worth taking a look at to see like what's going on and how can we support. And really it is just that bravery, that vulnerability about starting that conversation and or going toward the people who are having it, like Michelle Obama. She had that whole policy out when she was in office to help with healthy kids, right? So like it's out there, but like now it's like gone, you know, like now it goes like hush, you know. So
yeah, but and then we have these conversations and we have these influencers who are having these conversations or implementing new policy, and then you got the right, the left, the swing, the everybody tearing it down without considering what we see, why we chose this work, why was it necessary to happen, and then don't the parents ever right and the children ever right? Why everybody's dying? And I'm just trying to figure out, do we want wellness? And I know that well-being is an individualistic thing, but we have to have these conversations. So the fourth social determinant of health is neighborhood and built environments. One of the things when I hear you as a bariatric social work nurse, that's going to require the ability, whenever you have surgery, requires you the ability to have access to even a place to work out, right? Because you have to get physically fit while you're losing this weight, because a lot of things are going on with the body. I have a friend who had the surgery. That's why I'm like, oh well, yeah, I know. I was there when she was going through it. Quite a few of my friends. And so what I realized one day when I was standing on the treadmill walking, I can afford to have stuff in my home. I can afford to have that's I'm privileged. I'm privileged to be able to go to a gym. I'm privileged to be able to have equipment in my home or to purchase stuff in my home, privileged to have access to those things, but there are many who are not. What can we do, or what is being done in our neighborhoods to increase access to facilities that offer this as an option, whether it's bariatric or not?
That's such a good question. And again, it does come down to what you have access to, where you are at in the economic chart, right? I mean, I know that there are insurances that offer reimbursement for gym memberships, and some have like coupons and things like that to be able to have a discounted rate, which is important. Perhaps it really is about just getting a group together and go walking, right? And so being able to put that out there, because that's something that it checks off so many boxes, that those group workouts, and walking counts.
Yes, it does.
That's something that people think that they have to go to a gym and they've got to be lifting weights. If you've got stairs in your building,
walk up and down those stairs.
I did it. I made it a thing, right? And so being able to, maybe there's a track, or maybe there's stairs outside somewhere that you want to go to. Maybe there is an opportunity for you to play a sport. Maybe, bouncing a ball, jumping rope. It doesn't have to be so expensive to be able to get movement in, because in some cases, and I tell some of my clients, even if you don't have access outside, walk around your living room like 7 times in between commercial breaks. Do squats in the bathroom while you're brushing your teeth. Counts, right? And so it's
walk during a meeting, walk in place while you're in a meeting.
Exactly. So it's really about being creative with it and kind of getting away from this, like what it's supposed to look like, with just what you have around you.
Right. That's good stuff. And I totally agree. There's also options on YouTube. Where's everybody these days? In front of their phones.
Yes.
If you're in front of that phone, you have access to social support, you have access to groups, you have access to exercise classes. YouTube education is huge.
Yes.
And so that's a lot of places where I would run to just do exercise. If it was raining, I would just pull up a video.
Yes.
So this is really, really good. It's been exciting, even just to have this conversation, to start off with you, Candace, doing so many wonderful things in the community. Nice to have this, face-to-face meeting with you in this way, that to share you. How can people reach you?
Yeah, so my Instagram is the best way, because that's where you can get to me to everything else. And that's my email address as well. So it's the bariatric social worker at gmail.com, or just on Instagram.
Right. Do you do Facebook or LinkedIn or any of those?
You can find me on LinkedIn. Absolutely.
Okay.
Candace Moxey, Candace D Moxey. That's my LinkedIn page, and I got all my bariatric stuff all over it. Facebook, just my personal Facebook.
Okay. Gotcha. So the last part that I have is social and community support. You touched a lot on the importance of support groups. Is there a particular structure over support groups that you would recommend over another?
I think that all of them are really effective. So one, in terms of when I run my groups, I run a lot of open groups, right? And so that basically means that every session there might be a new person, right? Or there might be a smaller group or a larger group one month, right? And so it's open. Various people are coming, and I think that it's really helpful because you can hear from different stages, different perspectives, different backgrounds, different ages, different genders, all the above. Very, very, very helpful. And then I also feel that closed groups are really helpful as well, because in that case it is niche down. You are looking at a certain age group. The demographics are very similar. The experiences are similar, so that there's more of a confidential and private experience, and that's helpful as well. Sometimes larger groups work, and sometimes like smaller groups work. So yeah, I really think it depends on what you're serving. So I'll do it all.
I agree. I agree with that. I'm a big on group facilitation. The other question I had, there was one more that I had. Did I just draw a blank? I believe I did. But so I am really big on online social support groups as well. And do you have any policies that you're currently looking at that we should be thinking about as Black women? So first of all, I didn't properly introduce myself. I'm actually the president of Eastern North Carolina Regional Association of Black social workers, but I'm also the executive director and president of the National Coalition of Black Women Rising. My work meshes all together in the work that I do, and as a professional, I am also utilizing my profession to help others integrate technology into practice, which is my expertise as a human. So my concern is, what policies should we be looking at? What are you thinking about in terms of macro level work as a social worker?
So definitely in the bariatric community, I've experienced a lot of conversation from other social workers throughout my career where there's a conversation around, why would a social worker be on a bariatric team? Why? That it's like a real question, right? And so I'm like, because there are outside noise things that happen that will impact their experience. I feel that it's important for a person who is going through this experience to have a full on package. Okay, so we're talking about, like, if you're signing up to have this surgery, not only do you get the consultations with the nutritionist and the dietitian and the surgeon, and you've got these open support groups, but you should absolutely have access to a therapist that's specifically assigned, not just that psychological assessment in the very beginning. You should absolutely have access to a gym membership. This should just come with it, right?
Right.
Maybe there is an opportunity to even give a couple of vouchers for all these protein shakes that you're going to have, and more than just samples of vitamins. I have had people reach out to me asking, well, this person can't afford, they're concerned about affording all the protein shakes. well, this person's probably not a good candidate right now for this surgery because it looks like it might set them back.
Right.
This is why social work is important, because we need to be able to help assess their support systems for
That's right.
success. So
that's right.
Just the surgery has a full comprehensive package, even if it's for a short time, but at least sets them off for a good, good leg in this.
Yes. And aside from that, Candace, one of the things that happens, we find happens all too often across all disciplines, where the decision makers are at the table making decisions about individuals without the people with the lived experience.
Yeah.
That is so important. That is a conversation that we have to keep lifting and lifting hard, because it is not acceptable for those who aren't experiencing this to be making all the decisions about those who are experiencing it.
Yes. Yes.
Without having these conversations, and it really is something that we're working on very diligently at the National Coalition of Black Women Rising, because we know that the lived experience is important. One of the things that even with my program, We, Innovative Approaches to Manifesting Wealth and Excellence, one of the things we do is we lift the women with the lived experience to be the peer support.
Mm-hmm.
Because they have something to give.
Absolutely.
They have an experience.
Absolutely.
Some woes, the do's, the don'ts, the successes, the failures, all of the things, and how they coped and lived through the situation, how they made it over, how they may have stumbled and got back up.
Yes.
So thank you so much. This has been an amazing conversation. Again, everyone, you are talking with Candace Moxey. She is a social worker, otherwise known as the Bariatric Social Worker on Instagram, and she can be reached there at the Bariatric Social Worker. And you are talking to Dr. Eve here, and the host of Touch One Life, Touch Millions media podcast. And we are excited to share with the world what the modern day provider of services look like. What does that look like? And thank you so much for sharing. And the world is so much better for having you in it, the work that you do. And we thank God for your technical skills. Any offerings for those who do not have it?
Be patient. Be patient. And just keep pushing. We're all trying to figure it out. We're all trying to figure it out.
We are, and I'm here to help. So if you need support, everyone. Also, I heard you say you didn't do Facebook, but I also have a group called I Am Wellbeing. That's the goal for the work that we do, is to get people well, for us to all be well. So join us over there if you want to learn, and you are a provider out here who's wanting to launch a career in pivot to the internet space. That is the work that I do. So come and join us in the I Am Wellbeing community. Don't forget to follow Candace Moxey, the Bariatric Social Worker, the Bariatric Instagram, and learn all kinds of good deeds about how to stay well. Peace and blessings to you all. Thank you again, Candace, for sharing time with us today.
I appreciate it, Dr. Eve. I really